sure we show up.
Yeah. So anyway, all three that were up, they got them.
Good morning, everyone, and thank you for joining us for the meeting of the San Joaquin Valley Insurance Authority. We're going to take up our agenda. Item 1 is to call the meeting to order, and I have done so. We will now take up item number 2, which is the Pledge of Allegiance. We will be led this morning by the supervisor, who is the most urban amongst us all, and that's Supervisor Borges.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Brian's going to be here in a couple minutes.
A few minutes late.
Yeah, well, he's trying to fight everybody's dead cow issue.
Okay, all right. Well, I don't know anything about the
You
dead
got
cow.
dead cows over there?
I don't know. I haven't seen
Beef,
dead
it's what's
cows.
for dinner.
All right, item number 3 on our agenda is roll call. We'll take that up at this point.
Director Borges,
Present.
Director Crocker,
Here.
Director Ms. Megsig.
Megsig? That's me. Here.
Thank you. Director Mendez,
New one.
Yeah, I'm in Visalia.
a great
Director
place.
Pacheco,
Coming.
coming. Okay. Director Vanderpool.
I'm glad I'm not in Fresno.
Why?
I'm here in Visalia, yes.
Director Worthley.
Present.
All right, thank you very much. We do have a quorum. We will move on to item number 4 on our agenda, which is the approval of today's agenda. Anybody have any comments, corrections, suggestions, additions, deletions? Chair will entertain a motion.
Rule.
Have a motion from Director Worthley.
Second.
Second from Director Crocker. All in favor, please signify by saying aye.
Aye.
All opposed, the same. Motion passes. We're going to move on now to item number 5, which is public comment. At this time, members of the public may comment on any item not appearing on today's agenda. Public comment can and will be limited to 3 minutes. I do have requests regarding item number 12. We can take that up when we get to that item. I have a request to comment with no specific item referred to from Laura Hernandez.
Members, my name is Laura Hernandez, and I'm here speaking because I had the opportunity to be able to take a vacation day and be here with you all because it is important for me to be part of this process of ensuring we have the right adequate health insurance plans for the employees of Tulare County and as well as myself. I worked for the county for 15 years now, and I'm very honored to have been working for the county. But I'm here today mostly because I just want to continue to implore collaboration and focus on collaboration with the HPAC committees, with the different members in the community to come up with a plan to ensure that the well-being of the employees of Tulare County is maintained. And that means I understand that you guys have business. At the end of the day, you got to take care of business, cost savings. I just want to make sure that you guys recognize there's a human element in everything that happens in Tulare County, and that's the people that work for Tulare County and Fresno County and every county within the scope of California. Human beings are what move things. They are the ones that are out there working every single day, and I just want to make sure that you guys recognize that in the decisions you make and that you work in the spirit of collaboration with as many people as you can to ensure that the rates, whatever it is decision you guys need to make, is an adequate one, a fair one for the people that are taking care of business. Okay, thank you.
Next, I have a request from Maya Doherty.
Good morning. Happy Thursday. My name is Maya Doherty. I am an internal organizer for SJVIA 521, and I'm a former Tulare County employee. I wanted to talk about a few things. First of all, the EPO plan. I know the subcommittee for HBAC in Fresno County has moved forward with a recommendation. However, it hasn't gone to full HBAC yet. So we want to make sure that, according to the bylaws, that it goes to full HVAC before it's presented here for your recommendation to move forward. Secondly, in Fresno County last year, employees received a $50 increase, and it was very appreciative from the county that you guys were able to do that for us. However, even with that increase, there were so many employees that still had an increase to their to the amount that they have to pay every single month. And this affects our lowest paid employees especially. And I get bombarded with questions from so many employees about how is it that they can make decisions that will help them stay healthy when they're having to choose between paying for going to the doctor and paying for food for their family. So we would like for you to take into consideration that there are still there's still a lot of money that these workers are having to pay out for that. And then we have, as far as the capitation, the $12.8 million, we know that there would be cost savings moving to the EPO that are proposed, and we want to make sure that the cost savings are prioritized to ensure stabilization of SJVIA. It's important for Fresno and Tulare County and everyone else who's involved, and we have a couple of things that we would like to see done there. One would be reduction for healthcare premiums for workers, a wellness program that's geared towards education and prevention, and then the stabilization of the SJVIA reserves to prevent any future crises. In addition to the wellness program, we would like to have a wellness program that's centered on education and prevention. There's going to be an item that comes up, item 15, and it has a tobacco use surcharge, and we recognize that while we're concerned about cost savings, a wellness program that's focused on penalizing the employees is not going to be a benefit. It's going to be a deterrence. So we would just like for the wellness program to be focused on education and prevention. Thank you.
Thank you very much. Are there any additional public comments this morning? Sure, please come forward. You can use either microphone and state your name and address.
Good morning. It's nice to be here. Thank you. I see Mr. Borges there. I know some of you. My name is Ed Dunn, and I'm Director of Sales for the Western Region for Integrated Prescription Management. We're the only PBM, believe it or not, locally based. We're valley-based out of Fresno County. We have most of our employees, all of our employees in the West here are residents of Fresno County. We have been involved in the PBM review process in prior, but we're not invited this year, and quite frankly, we're a little disappointed. We would like to have been invited to participate. All the rest of the PBMs are out of state, and we're right here in your backyard. So I don't know how it happened. I guess the good news is we can still respond if given the time and a little bit of time, and not still make your analysis. So we would like to be able to do that if we could. But in any event, we wanted, for those of you who don't know about us, that we are here, and we service not only Valley clients, but clients across the country. And I'm here with my colleague, Rob Takoyan, and we'd be pleased to answer any questions afterward. But if there's any chance that we could still be involved in this process, we can respond quickly. If not, I hope we get invited next time. We really would appreciate it. Thank you so much.
Thank you. Are there any additional public comments at this time? Okay, seeing none, I'm going to close the public comment period and continue on with our agenda. Item number 6 on the agenda today is a request to approve the meeting minutes of the board meeting of April 28, 2017. Any comments or corrections from board members or members of the public? Seeing none.
Move for approval.
Chair will entertain a motion. I have a motion from Director Magsig.
Second.
Second from Director Crocker. All in favor, please signify by saying aye.
Aye.
All opposed, the same. Motion passes unanimously. We're now going to move on to item number 7, which is an information item. SJVIA Director questions, announcements, and activity reports. Anyone want to talk about any of their activities or plans for the 4th of July weekend? Anything to that extent? No comments? Come on, Borges, you always have something to say.
Seriously, man.
Good?
I got my abalone a week and a half or 2 weeks ago, so
Okay.
I'm staying put for 4th of July.
That's great. That's great. I'm glad to hear that.
Go get them personally?
Mendocino.
All right.
Any
Good
other
stuff.
director comments? All right. Thank you very much. We're going to move on now to item number 8, which is an information item. It's a request to receive an update from the auditor treasurer on cash flow projections. I believe this is Rhonda.
Yes, it is.
Hi, Rhonda.
Hi.
Welcome.
Thank you. I work for the County of Fresno, like you said, in the Auditor Controller Department. I will go over the cash flow presentation. I don't know if you guys have slides, but if not, I did give you an updated packet. I had to change a couple of areas, but the information's about the same, okay? Okay, start with the assumptions. You guys know this, if you've heard this. We use historical data, and so up from January of this year to July to June 20th, we are using actuals. So that's plugged into our model. From June 20th to the end of the year, we use estimations. Yeah, thank you. And so anyway, just to give you a heads up, to date we have $9 million that have been advanced to the authority, 2 of which was just recently loaned by the County of Tulare on the 11th. We did go before our board on the 16th and have the board has authorized an additional $3 million to have available to SJVIA through next year of this time.
That was the Fresno board.
That's a Fresno board. Thanks, Rhonda. Okay, and so this is just this is not where we stand right now. This is what we brought before to you last board meeting. And so the next slide basically shows you when we received the $2 million, I circled it there, and what that did to our projection. Take note that on the 7th of June, we did hit $1 million in the bank, and so we would have closed with a zero balance. It did spike because we received 2 payrolls 2 days later. Today, I did look at the cash, and we have $2.7 million. So without the $2 million, we would be at about $700,000 today in our bank account. Okay, and the next one is basically from July 1st to the end of the year. It does look like it's progressing. We're pretty stable. I did get a notice yesterday that we have a high PPO claim that's coming through. It's those kind of things that's hard to determine and say that this is going to stay consistent. So just bear in mind that this is a moving, presentation. So I mean, when I bring it to you in July and August, I'll update this as well. Okay, and so I'm going to go over the 19 entities that left as of last year. Our previous consultant had estimated about $2.4 million. We are at about $2.9 million. And just keep in mind that our claims go out for about 12 months, and our RX goes out. So we have about 6 more months of medical, 7 more months of RX. But to be honest with you, it is trickling in very slowly. So I'm not expecting, well, we're hoping no surprises for these 19 entities.
We're hoping so as well.
Say it again.
We're hoping so as well.
Yes, exactly. Okay, and last but not least is Sutter. Keenan had estimated about $1.6 million for Sutter. We were expecting maybe about 1.1 for the month of May. We came in at 645,000, so that's good news. But for June, we thought about maybe 14%. We're actually at 20%. So we're looking at 60% of that 1.6 million is what has come in so far. So that leaves us roughly, $657,000 left in my projection. So when you see that, I'm spreading that over some time there for the end of the year. Okay, any questions regarding?
Any questions or comments from board members?
I just have a quick question. You indicated that there was a large PPO claim that came in, and I was just thinking, when you do your calculations, do you take into consideration that if it's a reinsured covered claim, that's part of your calculations?
Well, part of that is our claims run out. So I do have a contingency in there, but I'm guessing this might be about $100,000.
Oh, okay. So it's well below our reinsurance
Yes.
kicking in. Gotcha. Okay, very good. Thank you.
Yes, it's well below.
Supervisor Crocker.
You mentioned Fresno County authorized additional resources, but that isn't reflective in here.
That is not
check
reflective in here.
actually cashed. Correct.
Exactly, and to be honest with you, we got a little bit of a spike this month because two situations. One, the Sutter claims run out came under projection, and two, we did receive an RX rebate for about $500,000, and so it's hard to predict those kind of refunds and situations. So that did swing us up a little bit, and hoping we have some more elements. And then what Keenan's going to talk about and what they're going to inject. So this could change, hopefully, maybe October or down the road. But it does look like it's stabilizing, so that's good news.
Okay, any additional questions or comments? All right, seeing none, thank you very much, Rhonda. Appreciate that. We will now take up item number 9, which is a request to approve the staff recommendation to enter into an agreement with Price, Page and Company to audit financial statements for the years ending June 30th, 2016, 2017, and 2018.
Okay, back in January of this year, I released 11 RFQs going out to audit firms, 2 of which were in the city of Visalia, Noel Agnew and M. Green. I only received 2 closed cost bids back from that RFQ. One, of course, was Price Page, our current firm, and the other one was Moss Adams. And so it is our recommendation to enter into an agreement with Price Page and Company to audit financial statements for fiscal years ending June 30th, 16 through the 18th, and authorize the president to execute the agreement subject to the approval of the board and county council.
Any questions from board members? Comments from members of the public?
So moved.
Okay, I have a motion from Director Borges, a second by Director Mendez. All those in favor, please signify by saying aye.
Aye.
All opposed, the same. Motion passes unanimously. Thank you very much.
Thank you.
All right, next we're going to move on to item number 10, which is a request to receive and file the consultant's report on the SJVIA plan experience through April 2017. This is an information item, and I'll turn it over to board.
Hello, my name is Borden Darm with Keenan Associates. I'm the consultant for the SJVIA. Oops. That's bigger somehow. I'm here to, thank you. This is the experience report through April of 2017. I think one of the important things to note on this report is how are we doing in the current year? The board took action for 2017 to significantly increase rates, and through April of this year, there's been an accumulation of reserves of $2.2 million. Now, that does not mean necessarily that there's $2.2 million sitting in the bank from this year because we also had to pay, as the auditor reported, the run out from the previous group. So those funds were actually then used in part to pay back the run out as well too. But what the overall statement is that the experience and the renewals, the rates that are setting right now are in such a position so that reserve accumulations are occurring through 2017. If we're at 2.2 million after 4 months, and that trend continues, then it would appear that towards the end of the year we'll be around 6.6 million, barring that trend continues. If there's an alternate trend that comes into play, that number will vary. I wasn't going to get into the specifics of each HMO, PPO, and so forth. It's there for your review. I will say this, if I can just kind of share, we kind of bucket the SJVIA into 3 different buckets. There's the County of Tulare, there's the County of Fresno, and then all other, which comprises of City of Marysville, City of Ceres, and City of Waterford. This experience report is specific only to the 5 entities that currently make up the SJVIA. We removed the County of Sutter, so their impact, which when they left after April, was approximately a $200,000 deficit position, plus whatever the runout that we're realizing now. So you can take that off of that 2.2, but these are the 5 entities. So this gives you a good snapshot of those entities that are currently participating in the program and the accumulations. Of note, if we have the County of Fresno, which is approximately $890,000 of the 2.2 was accumulated by the County of Fresno. The County of Tulare is approximately $1,150,000, and the all others, it is a much smaller group, but it was still on a positive direction at $200,000 as well too. This will become meaningful as we address some of the other issues relative to renewal underwriting for 2017, because obviously when we set the renewal rates, we'll have to take where the current rates are into consideration with them, and we'll be coming back with recommendations on July 14th when we do the preliminary renewal relative to here's the projected cost, here's the current rates, here's the difference, and then make the have you come back with direction for the appropriate adjustments and so forth. Are there any questions on item 10 that I can answer for you?
No, the only comment that I would make is just that we have to be very mindful as we go forward and talk about the underwriting guidelines and establish what we're going to be doing for the next year. You know, you talked about where the 2.2 million has come from.
Right.
You got to remember if that a little over $1 million has come from Tulare County and about 800,000 has come from Fresno County. Fresno County is probably twice our size in terms of plan membership. But yet more money has come from Tulare County, and I don't. This isn't a county versus county thing, but we have to be mindful as we set. We're doing a lot of different things within the SJVIA.
Right.
For example, we're going to be talking about an EPO option later in this agenda. That's strictly to benefit Fresno County. There's nothing in it for Tulare County, and so we're doing these different things, but the cost is being borne by all. So as we set renewal guidelines and what we're going to be doing on a go-forward basis, I just ask that my colleagues be mindful of that as we do that. So, and you as the consultant as well.
Right. It is our intent that when we come back July 14th for the preliminary renewal, that we will show you very specifically what the cost is by coverage and by entity as far as of the 5 entities, and then as well show you the variance between that. I wholeheartly agree. There has to be an equitable distribution of reserve accumulation as well as making sure that the deficit is paid off appropriately as well too. So one of the things I know I'll be coming back to you for is direction on that July 14th meeting, so that when we come back on August 25th for the final renewal recommendations, that you've given me clear direction relative to what is equitable relative to the reserve buildups and so forth. So yes, we're very open to that. We want to make it fair for everybody in that process.
Sure.
Yeah, sure.
Well, I
Supervisor
think
Ward.
maybe to go in a little different direction, and you're talking about basically the reserves being built up, but as I look at the average cost per claim between Fresno County and Tulare County, I mean, there's a huge difference, significant difference between those cost per claim averages. And that goes to the point of equity in terms of paying for the insurance of our employees. I mean, our employees, their claims are averaging, looks like $200 to $300 per claim less than Fresno County's. There needs to be some recognition of that, and when we're looking at setting our actual cost, to our employees for next year's premiums. I mean, we just can't continue to have some kind of, I know we've talked about this before, but a blended rate that is borne significantly by Tulare County is killing us as a county, because and our employees, because they are, as Pete said, half of the population size of Fresno, and yet the cost per claim in Fresno is significantly more than Tulare County. This has to be addressed.
And it will be. It's at that July 14th meeting when the preliminary renewals are presented. It will show each entity by coverage, including their paid claims, will be built into. Here's what the projected cost is, and here's what you're currently paying. So if there are discrepancies, and they do exist between all entities for that matter. It will be reflected at that point in time. So perhaps, just to use an example, let's say the difference between projected cost for Tulare and what the current rate is, a difference of 10%, so that the cost falls under by 10. And for Fresno, it's 5%, or whatever other number you want to choose. And that's something that you'll see and hopefully give me direction on how we can make that equitable as a distribution as well, too.
Okay, thanks.
Any additional questions or comments? All right, that was an information item. Thank you very much, Borden. We're now going to move on to item number 11, which is a request to receive the consultant's report on the proposed SJVIA renewal underwriting guidelines. This is an information item.
Okay. And I'm going to focus most of my attention to the second page, which has a big old chart on it. And I hope you will indulge me, because this is the basis of the underwriting guidelines that we would like to set in place. How do I make this bigger? Get rid of that. As big as possible. Thank you. Okay. For the new business, for the renewal underwriting guidelines that we're proposing, for the most part, it's standard underwriting features with a couple of adjustments relative to this being a JPA as opposed to a single entity. The two biggest adjustments are, one, because it's a JPA, we look at the experience of each group and we have to make determinations relative to the credibility. The credibility of the experience, meaning can we project off of it? Is it large enough to do that? And the answer for the County of Tulare and for the County of Fresno is yes, absolutely. It's 100% credible. We can use that experience. Can we do that for the other three? And the answer is no. Their credibility, they're too small, and projecting what happens to them in the future is not as predictable. So we are recommending that they receive zero credibility relative to their experience, and that they receive an overall pooled rate. So what the JPA would have as a renewal, that's the general renewal that they would receive. In addition to that,
Sorry, let me interrupt you there. But that typically, because of the uncertainty due to size, typically that's going to be a better pool. The pool rate will be better for those entities than what they would have normally gotten individually without the economy of scale of the entity. Correct?
with the economies of scale on their costs are much lower, and the one area where with the previous consultant where I took exception to was sometimes when the question was asked, how did these individual entities do? Did they help us? Did they hinder us? None of those entities would have had a reinsurance level at $450,000 on their own. They were much too small. So what that did is oftentimes it could skew the results. So for instance, if you're a small entity and you had one large claimant at $500,000, well, according to the guidelines at that time, that $450,000 counted towards your experience because it was below the reinsurance. And you take $450,000 and divide it by a few lives, it's a huge event. In the same token, if another small entity had really good experience, hardly used the plan, they could have it skewed way down low as well too. And that's why we say no, we're not going to do at 450, nor are we going to do, and give you the benefit of your experience at a very low point, but rather we're going to say we're going to create their own rate 100% pooled relative to that. Did that answer?
Yeah.
Okay.
Thank you.
And
you.
I have a follow-up question. So along those lines, why can't you take a look at age of the employees that are part of that pool, overall health, so things like body mass index, and then take a look at previous claims history of those folks? Because clearly, if you're involved in an automobile accident, there's no way to predict those types of things, but you can take a look at the activity level, the age, and you can get a good idea and previous history of how much insurance is being used in the past, even if you only have an entity that's 200 people strong. So I assume that we're doing that moving forward. And again, looking at, and something else too, looking at economies of scale. Economies of scale work to our favor as long as those in the pool are healthy. If our large pool consists of individuals who are unhealthy, economies of scale, as far as I'm concerned, goes out the window because rates are higher because the number of people that are within that pool are unhealthy and use a lot of insurance. So I assume you're looking at all of that as well. And as my understanding, a lot of the smaller entities that were a part of the pool in the past had more healthy individuals that technically should have helped out the pool as a whole. Is that a true statement?
There certainly were some. I'll take County of Sutter as an example. That certainly was not. And I can't necessarily say that they were unhealthy, but I can state that the rates that they were assigned did not reflect the actual claims experience that were given. So they could have been real healthy. It's just
so they
rates
weren't
were too low.
Conservative and very competitive then.
Correct.
Thanks.
I appreciate those points as well too, and our underwriting model takes that into consideration. Now, keep in mind, and this is one of the big areas where we have to look at. For instance, one of the demographics that we look at very carefully is the dependent ratio. So, for instance, the HMO covers more dependents than the PPO does, and so from that perspective, even though there's a higher, there might be a higher paid claim total in that, it doesn't mean that they're necessarily unhealthy. Some of it could play a geographic location, the cost of health care in one area, such as Tulare versus the County of Fresno. There's a variety of factors. We take that into consideration, but in the same token, those demographics, based off the past history, which we definitely look at, our models start with row A says paid claims. It's where we start. We look at the last 12 months of paid claims to underwrite off of. So that reflects the demographics, the dependent ratio, and all those things. And we'll report on what those various factors are so you have a clear understanding of what those factors are and what the factor for the SJVIA is in total, so you can compare how each group is doing on its own as well too. And the other area that I wanted to share with you is for economies of scale, and I'll get into this a little bit further, but we do contemplate adding a risk share level. The risk share level, as it currently sits on a blended rate basis, basically says we're sharing 100% of the risk, and what the rates are for the two groups combined is what the rate is. Moving forward, what we want to do is have a risk share model that more accurately reflects what we would consider the less predictable claims. In other words, those that, and our proposal shows, because of Fresno's size, a pooling level at $250,000 and County of Tulare at $200,000, and creating a risk share pool, also known as a self-insured retention pool, between those levels, so claims above 200 and 250 respectively, up to the 450 reinsurance level. So that's where the risk is shared. We'll give you a complete analysis on what that looks like as well too. But I think what that does, it shows for both groups, hey, based on the unpredictable nature of large claims, we're in this together. Based on everything underneath, we'll be underwritten, and we'll be underwritten fairly. And we still have the economies of scale relative to the fixed costs associated. You'll share the same reinsurance cost at 450 or whatever level it is when we do that final analysis. But I think it's a good model that will work well for all people. It's intended to be equitable. I'm really looking forward to the July 14th meeting so that we can present that. It'll challenge you relative to what does equitability mean for each entity, and that's your direction that you can give me, and I'll come back with that. Okay? So let me just move very quickly move through the model. So if you have that chart in front of you, row A is paid claims. That's simply the raw data that we get from our partners, which is currently involved, Prescription Solutions and Anthem. We take that data. On row B, we adjust it for large claims, and those are all large claims on the HMO above 400,000 because that's the current pooling point, and on the PPO at 450,000. So anything above that, that's reinsurance money that's paid out, and so those are taken off. Once that subtraction happens, we end up on row C, where we have adjusted paid claims. And here is where the pool to risk adjustment comes in, where we look at those claims that fell between 200 and 450 for the County of Tulare, 250 and 450 relative to the County of Fresno. That's the pooled layer that we'll be looking at to develop basically a risk pool charge relative to it. That's where you two are combined, and that's the only area in paid claims where you guys would be combined outside of the reinsurance above that. Below that, below that really reflects, there's a rule, and that rule states that 20% of your population incurs 80% of cost on paid claims, and the opposite is true too. 80% of your population incurs 20% of cost. And so below those pooling levels, it's really based on your experience, your utilization on a day-to-day basis. And we've identified, okay, here's where you share, here's where we've gone to an alternative source for that. So we make that pooling adjustment, and then F, G, and H, this is where IBNR plays a role, and this is where I feel in the past you haven't seen where you're beginning. IBNR is where the ending IBNR or end of the experience period IBNR is, and where the changes in that calculation is made. So we will add a component relative to that as well too. And then the result of adding the change in IBNR to the incurred claim to the paid claims is that we have an incurred claim total. So we know pretty much over the experience period, and I should have mentioned that the experience period that we're looking at is we will be looking. We can't get data through June because July 14th happens too quick. So we will be underwriting data based off of June 2016 through May 2017. One difference from that underwriting to the final renewal because we'll have one more month of experience, when we come back at the final renewal point, we will have June data. Adding July is a little bit tight because it usually takes 3 weeks for us to get the data, and July 25th or August 25th will happen too close thereafter. So the recommendation is in the final renewal that we will underwrite off of data from July 1st, 2016 through June 30th, 2017. That's the most recent data that we have. We take that and we look at the total number of employees covered over that experience period, the 12-month period, and that brings it down to an average per employee per month cost. And so we know the per employee per month cost, and I want you to know that this process is repeated for each line of coverage, HMO, PPO, high deductible health plan, and then added up in total for each of the three entities or groups: County of Tulare, County of Fresno, and all other. And then, of course, it accumulates up to a total SJVIA report as well, too. So this is just one time. I'm going to go through it one time with you. From that incurred claim per employee per month over the experience period, now we need to project it forward for 2018. In the past, I noticed, and I was a little disappointed, it was asked, well, what is trend? Because we need to add trend to those numbers, and a survey went out, and I was included in that survey, but my results weren't included in that survey, but that's okay. But the question of what trend is, the SJVIA is large enough, is credible enough. We won't do it by entity individually, but we will do it by line of coverage for the SJVIA in total, and that is do an internal trend calculation and actually look at it. There's statistical methodology to doing it. We do it, and we will tell you exactly what that trend is internally. We will also use as a point of reference what industry trend is. Keenan does a quarterly update of what the insurance carriers are using for trend. We'll present both. We'll present our recommendation and what we use to actually do the underwriting, and I think it should be a very fair and equitable trend assumption going forward. Whatever that trend number is, it's an annualized number. Well, we're not going from one year to the next. We're going from an experience period that eventually, if we look at the period July 1 to through June 30th, that's going to need a year and a half of trend. So we take that annual trend and turn it into a trend factor over 18 months so that we can project appropriately. And that's what the trend does as well, too. So there we then have a projected claim per employee per month. If there are any plan design adjustments, and I've recommended that if there be any plan design adjustments wanted by any entities, and truly I think that means more County of Tulare and County of Fresno, because the smaller groups, we can't really customize plans for them or have them look at different plans. They have their standard plans that they should be able to choose from. That information be given back to me by July 15th. It's independent of the board meeting that we'll have. I know for County of Fresno, they've looked at it. I've heard from County of Tulare that there might be an EPO option that wants to be looked at as well. July 15th, I need to know, or we need to know finally what plan designs are being considered for next year. We plan on getting those plan design values back to the entities by August 1st, so they, with their health benefits committees, can vet that through their process, so that by August 15th, if I now need to incorporate any plan changes, that we can do that to the board for the final recommendation. So that's where we would adjust for plan designs. It also means on the HMO to EPO concept that we'll be discussing shortly, that's where that plan design value would go into, so how we convert HMO to EPO as well, too. And then again, dependent on what is done, if there's an elimination of a plan and so forth, there's always a selection value. If people migrate to this EPO because it's a better deal, we need to perhaps load a selection value because of increased utilization. On top of when we do the internal trend calculation that I spoke of earlier, one of the byproducts that we receive, and we usually use the 90th percentile, is we receive a margin calculation, which means that if we use the 90th percentile, 90 out of 100 times, we're going to hit the trend line. So the margin that comes as a result of that, we use as margin that we put in, so that we know we're going to have our claim cost covered at a high confidence level. And then from there, it's really we have, and the result there is then that we have our fixed projected claim cost for 2018. To that, we then add all the renewal costs, the fixed costs, which include the reinsurance, the cost of TPA administration. We do have a little bit of ACA fees built into that as well, too. And we go through all of those things, the cost for reinsurance and so forth, and eventually come up with a total cost. And that total cost, like I mentioned previously, is then compared to what's the current rate for that and what's the difference. And we use it based off of what we simply do is we'll take the current month enrollment at that point in time, which will be, well, current month, which will be June for the final renewal, will be June of 2017. We'll use that enrollment, figure out what the cost is on a PEPM basis, or the premium on a PEPM basis, compare it to what the projected cost is, and the difference is kind of the tough decision that you guys have to make relative to how do we actually want to set those rates, how do we want to accumulate, how do we want to implement wellness. Director Maxig, I agree wholeheartedly with you relative to wellness and rewarding for participation in wellness programs. We're not at a point where we have the data where we can do that, but as we go through item 15, we are eventually going to be there, and I believe there's a health wellness factor that will be factored into here as well. It cannot be done at this point, but it can at a future point, and that's part of the overall plan for that. So, any questions relative?
Go ahead.
Is there any provision in your analysis, or does that just come back to the board at a later time about reimbursement of the county's advanced cost out of premium payments?
No, there's not, and it's with a specific purpose to that. What I can show you is I can show you the difference between cost and current rates, or if you say, hey, add 5% on top of rates, if we do go that direction, what the difference is. I believe it's to be a board decision relative to how that is handled.
Yeah, I think you're right with that, and I agree with that. A question that I have is I just want to make sure, I know you had talked about where the costs are split between entity, and you talked about between the insurance levels. Is there going to be an option for us to look at that's going to not pool the rates together, but only share the fixed cost component as individual entities?
That was, I can certainly take that as direction.
Okay.
That was not part of the underwriting guidelines relative to it, and my reasoning for that is if there's no risk share whatsoever and it's simply done off of the $450,000 reinsurance level, and we just simply separate that out, then as an SJVIA pool, the only components that are really holding you together are the shared fixed costs that are at an economy of scale.
And it just depends how we actually set rates, and if it is mindful of County of Fresno experience versus County of Tulare experience. I just don't want to see rates fixed based on a pooling that artificially increases Tulare County's rates because of Fresno County's experiences.
You know, and it's an interesting concept too, because this is the starting point, and everybody wants it to be equitable for each other. In other words, hey, I don't want to subsidize you, and you don't want to subsidize me, but yet we're creating a pool where we're together. So I think it's very fair to have that when we initially state it, or developed the pool, that the pool charge and the costs really reflect the past experience that we've seen. In the same token, moving forward on future renewals, I don't know that that's the correct methodology, because it's just like with a reinsurer. Some years the reinsurer wins, some years the reinsurer loses. Just so happens, as I reported in our last board meeting here on April 28th, the reinsurers have always won. And so that same concept applies to the pooling. Some years one group's going to win, some years the other group. If it shows consistent, then I think over time we need to make sure we have the mechanism in place to adjust that. But to start with, I agree with you that we have to set it appropriately.
I'm very mindful of that, because I think when the SJVIA first started, there were years where the County of Tulare was being benefited by the County of Fresno's experience. However, the last 6 years, right. Or 5 years, whatever it's been very much skewed towards one particular entity. And I don't think that it's fair to burden everyone else with that cost. So if you look at the overall experience, and we've had that item presented, I believe, at the last meeting, of total premiums paid in versus total claims paid out, I believe it was the County of Fresno was $9 million to the bad, right?
I can't remember the exact,
I think it was something around that. But so I just want to make sure that $9 million to the bad doesn't get borne by Tulare County and other entities, if you know what I mean.
Yes, and I'll go back to the basis. We're going to underwrite off of the last 12 months, show what the cost is, show what the current premium is. The delta, the differential between those, is then where direction can be given. I'm not of the opinion either way. I think it's your direction. Do you guys have the same rate? Do you have different rates? Sure. And so on. So the intent here is to give you a level of transparency that puts you in a position to make good decisions that are equitable for all concerned, so that both say, yeah, this is fair.
That's what we want. Any additional questions or comments? Questions or comments? Go ahead.
You said it all.
Okay. I'm open, Mags. I'm giving you a chance.
I'm good.
All right. Okay, thank you very much. This was an information item. We're now going to move on to item number 12, which is an action item. This is a request to receive the consultant's report on converting the SJVIA's Anthem HMO plan to an Anthem EPO plan and approve eliminating the Anthem HMO plan and implementing the Anthem EPO plan effective January 1, 2018.
Okay.
Can I take care of your whole presentation just by reading that?
Yeah, pretty much.
Good. Item then.
Yeah. Okay.
I will say that I've presented this before at the April 28th meeting. Conceptually, this report, really not much has changed. Two areas that we went into addition. If you recall, I believe at the last board meeting, a number of about $3.3 million in savings if we convert from the HMO to the EPO. That means leaving the plan design the same, moving from the HMO network to Anthem's EPO PPO network. The only difference is, as we come to you now, it's with a reduced value to $2.8 million as the overall savings instead of 3.3. The difference in the value is predominantly due to, we had, if you look at the current HMO compared to the current PPO, the fixed cost associated with Anthem for administering the plan, there was about, it works out to that's the $500,000. As we asked for an EPO quote from Anthem, despite our efforts, there's an issue regarding the dependent ratio being higher on the HMO that says, no, we're not going to come down to the PPO level, and it's going to stay pretty much at the HMO level. So those savings, those were administrative cost savings, not claim dollar savings, would not be realized, and so in our revised report, we took that amount out. Otherwise, it's still the same. The reinsurance valuation is still adequate as well, too. The other thing that we did, and this is in working with the Health Benefits Committee at the County of Fresno, and as I talked to more and more people, there was just a very large concern relative to would people lose providers based off this change. We did a thorough analysis, and to the best of our knowledge, the HMO and the PPO, EPO network are, I can't say with 100% certainty, but very high certainty that nobody will lose, that the providers are one and the same.
Any questions here? I know that a lot of us have reservation about moving forward with any kind of savings given our situation, but yeah, I'm very glad to hear that this is going to still, regardless of a $500,000 decrease in savings, that number sure sounds good compared to where we have been. So I know that we do have a process to go through, and this might have to go back through the full health plan advisory group before it does come to a formal action by this board. Do we incur any additional cost by waiting until, say, the July 14th meeting, if a meeting of the HBAG and you can happen before then?
No, this is for a January 1 effective date. So
I just want to make sure.
We have sufficient time there. I will add this as well, too. The savings are specific to those participants that are in the HMO right now. So when we do the underwriting, it'll reflect that on the HMO as well, too. So one of the things that I really like about it is because the County of Fresno has predominant HMO, there's a capability to basically increase the amount of reserve buildup between current rate and that HMO rate, which can be looked at as well too.
Does this account for any possible migration that might be seen between, if we get rid of the HMO and let's say there's migration from the HMO plan to Kaiser, is there an accounting for that in this or not?
We wouldn't necessarily anticipate a migration from the HMO to the Kaiser HMO, nor from Kaiser HMO to here. We did have discussions within the County of Fresno with the Health Subcommittee relative to does the EPO eliminate the need for one of the PPO plans, the PPO 250 plan, which is the lowest cost deductible. And at the end, the recommendation from the subcommittee was we're not going to eliminate that plan.
Okay. And the effect on the entire SJVIA, I know that you said that there's, this is particularly the savings is going to apply just on the HMO. Will this benefit the entire SJVIA at all, or just those that participate on the HMO side?
And I think that goes back to letting me know by July 15th so I can price out. Because here's what the EPO does. The EPO, the reason County of Fresno has an HMO and County Tulare had an HMO, but it wasn't highly utilized, is because of network. Well, now the network has become one and the same for the entire SJVIA because it's basically built on the PPO network. So it opens up the HMO to groups that may want this EPO option now. And it further expands coverage because it'll be tied into Anthem's national PPO network, where you could potentially, students out of state or out of area, now it would no longer cover them on an emergency-only basis, but rather it would cover them as long as they see a PPO provider. So it expands the network significantly.
Interesting. Any other questions, comments from board members? I do have public comment requests. But go ahead, Supervisor Crocker.
Well, earlier I think in a previous item, you mentioned that Tulare County was interested in looking at the possibility of an EPO. So where's that in the process? When will we have
I need to get. I just need to confirm direction, but if I can get it prepared for the preliminary renewal on July 14th, I can. It shouldn't be that big of an issue for us to do so. I thought I was, and then I thought I heard from Director Vanderpool a comment that the EPO doesn't affect County of Tulare. So I just want to make sure.
It doesn't, because it was only the reason I said that was because it was only proposed for Fresno County HMO. And I know that we eliminated the HMO in Tulare County, and we have our own vetting process that we'll need to go through. But if it really is, in fact, basically a benefit to Tulare County employees too that may be using PPO providers currently, but can maintain their same provider maybe at a lower cost through this EPO plan. I would like to see that maybe offered here too. If it's an option that will save our employees money, I think that it needs to be an option for the county or for the SJVIA to consider at the 14th. Yeah. Supervisor Borges?
Just a quick question that I don't think Tulare is on the cusp of doing so, but were they to, would the entire model that we have through the JPA here essentially come down because we do not have the opportunity to fungibly offset one another in the lean and profitable years? If we're all in the one system, is this the end of the JPA?
Relative.
You're always so negative. You're always looking at like the end.
First, let me give a point of clarification for Director Vanderpool. The HMO is predominantly County of Fresno. Yeah. Our smaller entities have a component in that HMO, and that would also convert to an EPO. Okay. And then, I'm not sure I understood the question. If
he's being philosophical.
No, we exist right now by balancing out through a blended model HMO PPO. Would you agree?
Yes.
If Fresno goes the EPO route, and if Tulare theoretically were also to go the EPO route, would that essentially do away with the ability to offset one another because we're all in the same?
Yeah, not at all, because
no? Okay.
There's complete transparency there. Transparency in the claim. First of all, we'll get greater transparency because when we move from HMO to EPO, we have 100% transparency. Where currently in the HMO model, there's a capitation fee that blocks us from seeing some of the transparency, specifically provider, specialist visits, and lab work. So we will gain transparency by moving to the EPO model on that front. Once we have complete transparency, if you think of it three-dimensionally, we have our entities across the front where we provide complete transparency, and behind each entity, we provide transparency on the EPO, PPO, and the high deductible health plan as well too. So because of that transparent model, it doesn't really mean that the SJVA suffers. I don't see it suffering in any way. As a matter of fact, as we gain experience under the model, I can certainly see requests for even more creative ways, such as including healthcare factors. Personally, I'm of the opinion if I have one entity, and I'm not going to use the walking challenge as the sole point, but if I have one group that is dedicated and gets higher participation in health than another one, well, that should be reflected in a factor there that, hey, your rate's going to get bumped by 1% because you didn't really encourage your membership. It's our duty. It's going to be our duty to help communicate that to the membership, but it's the leadership is there to help us enforce that, or not enforce, but encourage further that type of behavior. So I see a lot of things still developing out of this. This is the starting block, but I don't see the end of the JPA because of the move to an EPO.
Senator, do you have any further questions, or are you good? Okay.
I just wanted to say that you were looking for direction. I think we do want to include Tulare County. And I was particularly taken by your thought of how it might apply to out of area physicians being within that system. So when you have a lot of people who have kids are out of the area going to school someplace else, right. The idea that they might be covered, that's a very intriguing concept. Even if it didn't save us money, if you will, if it was the same kind of cost but provided additional benefit to our employees, we don't want to be left out of that opportunity.
Yeah. Director Borges, it's on you now. Or not Borges, Magsig.
Wow.
He's over there talking, just distracting me, so go for it.
Hey, not a problem. Thank you. So, as I understand it, and correct me if I'm wrong, but looking at the current HMO that the County of Fresno has, it's somewhat antiquated. We kind of overpay for some of the services we receive. And so looking at, I'm sure that you've done a comparative analysis looking at what a future EPO would have charged the plan versus our current HMO, what it's been charging.
Yeah.
So as you've done that analysis for claims that have happened in the past, what kind of, are you looking at like a 15% differential, 20% differential? What does that look like?
It's approximately 22%. That's the difference between the 12 and the 9. And I think more importantly, I believe that to be a conservative number. And the reason I believe it's conservative is if you look at the PPO plan, if you look at the comprehensive, so not the high deductible because that has different behavior, but if you look at the comprehensive PPO plan, it has a per employee per month cost for all professional and other services, so outpatient, so your physician visits, everything that's basically done professionally, of $174 per employee per month. We're paying $300 for capitation for a portion of that.
And the reason I bring that up is looking right now at the county of Tulare, roughly on just averaging out claims, they're at about $330 more or less per claim less when you average everything out. And so if we're seeing a 22% conservative estimate, that really will bring us into alignment. So I think one of the reasons why we're so much more expensive is because maybe we haven't done our homework to make sure that the plans that we have in place are truly paying and covering us in the most efficient way possible. So hopefully moving forward, everything I've seen, I really like how this is bringing both Tulare and Fresno County into alignment. So no one entity is being burdened more than the other.
Thank you.
Any further questions or comments? All right, I do have a request from Suzanne Dean to make comment.
Good morning. Thank you. My name is Suzanne Dean. I'm the finance director for the City of Ceres. A lot of what I had concerns about have been addressed already, but I'd like to expand a little bit on the what the consultant said regarding the network. And I know the network had been analyzed for Fresno and Tulare areas, but what about for Stanislaus County, where the two of the other entities are? Our concern is that our employees, the network will narrow so much that our employees will lose their doctors, and our independent research indicates that this will happen. We don't have access to all the data that the consultant does, so we would request that we could get that information and how switching to this EPO would affect our employees specifically. We only have about 150 employees that take advantage of health insurance through our work, so we're very small compared to the counties, but the real impact on our employees is very very important to us. Also, we're concerned about we're not truly a pool anymore. Rates are going to be it looks like set so that our group is pooled, the rest are not. So we are expecting increases to our costs if this is done. We would like you to give us some indication if switching to this EPO will have a savings for us. And we think your consultant can do that if he has already done it for Fresno County. Thank you.
I have. Do you want to respond for Board, real quick?
Yes, we on a group basis, we will take care of the other three entities, including City of Ceres as well too, relative to any that capitation savings from moving from capitation that would impact Ceres as well too, relative to anybody else that's in the HMO as well too.
And everybody still benefits from a shared fixed cost, correct? That's
correct. Absolutely
included in the SJVIA
yes.
at all, whether you're a county or a small city, et cetera.
And I wanted to clarify, when we mentioned the 22%, that is based on that component alone. It's not on the overall, so we're not talking about a 22% rate decrease or from the overall rate. It's just on that component, the difference between.
You're talking about the capitation?
Yes.
Yes.
Thank you.
That's which is significant, though.
Yeah, it's still significant.
It is significant, yeah, sure.
Can you respond to the providers as far as the access for Stanislaus County? Or can you research that?
For Tulare County?
No, for Stanislaus.
Stanislaus.
Where Ceres is located.
For the cities.
Yeah, we can take a look, and I can work with Anthem relative to that to making sure that the same impact for Fresno County, which is basically 100%, that also applies to Ceres. Thank you.
Thank you.
Thank you. I also have a request from Bobby Bloyd to comment on this item.
Hello, Bobby Bloyd, Fresno County Health Benefits Advisory Council Chair. I have a couple of points that I want to make to you today. One, whenever we found out about this a couple of months ago, our members actually started going to the Anthem website to try to determine if their providers were doctors under the EPO network. And unfortunately, what we've determined is the Anthem website needs a medical plan of its own, because depending upon how you press the search button, changes what you see on the screen every time you search. So we asked our members to start contacting our doctors directly to find out if they actually accepted the EPO plan. And what we've been told is from multiple members that if you're already an HMO member with an established doctor, you can maintain your relationship with your doctor. But if you try to transfer to that doctor as an EPO, their practice is closed to new EPO patients. And we're hearing more and more of this as we're getting responses back from the members. And it's kind of disheartening to hear that if somebody wanted to move to another doctor, they couldn't do that. Early on, whenever we were talking with the consultant about this, we asked what happens with the claims, because now we're moving to a fee-for-service basis. And what we found was that the consultant used a small percentage point for increases and projected additional claims coming in. So on the paper that I gave you, it shows the capitation charge versus what could happen with a 25% increase in additional claims coming in under that plan. And if you notice that there's no savings at all, in fact, it's going to cost us more. So we need to very carefully look at this to make sure that this is actually correct. And I'll give you an example. Right now, all of the doctors on the HMO plan are paid a capitation charge. What that actually is, we don't know. But if you go in and say, my elbow hurts, and the doctor treats you for that, and while you're in there, you tell him you have 3 other things wrong with you. The doctor's going to tell you, you need to make 3 appointments. So now, rather than having 1 claim that comes in under the capitation model, you're going to have 4 claims coming in. So we have a potential exposure here for additional costs above what we're paying with capitation. So I just want to make sure everybody is aware that that possibility exists. We hope it doesn't happen, but it could. Thank you. And I'd like to ask the chair to note that I want to speak on 2 other items.
Yeah, I actually have your, you're going to be a perennial speaker, and I've got you here taken care of for the next couple, so I got your numbers. Next, I have a request from Sandra Brock to speak on this.
I apologize for being a little bit late. I hope I don't misunderstand this, but at a prior meeting, I believe I asked what happens if you're on vacation and you need care out of network other than an emergency room, and I was told no payment would be made. This is pretty horrifying, because if you have an HMO, you can't have a health savings account, so you don't have any dedicated kitty of money to pay unexpected medical bills. Personal experience, my cousin had a gallbladder attack, and she's looking at a $13,000 medical bill because her insurance said, oh, sorry, out-of-network care, we pay nothing. You don't want to bankrupt your employees. If you're going to go from this HMO, which pays something for out-of-network care, to an EPO, which pays nothing, I beg you, offer some kind of supplemental coverage or find it for your employees. If they take a vacation, if they go see their aunt in the next county, any number of little things can happen. People tend to get hurt more on vacations. They're doing things they don't normally do during the day, especially kids. I am on the PPO plan, high deductible PPO as a retiree, so I would just like to confirm that this change would do nothing to my plan, right? Yes? Okay, I see yes. Thank you very much for considering my comments.
Thank you. Do I have any additional public comments at this time? Okay, seeing none, I'll bring it back to the board for discussion and or direction. I know this is agendized as an action item, but I do know that there was a comment made earlier about needing to go through a due diligence process that Fresno County typically goes through. It needs to go through the whole health plan advisory group, not just the subcommittee. Is that correct?
Yeah, and just to kind of clarify your action today, so you're essentially approving staff and the consultant going back and calculating the model that we've talked about here today.
Okay.
This isn't approving the rates. This isn't finally approving the plan. So the way it's written, it's a little confusing.
Yeah.
In Fresno, we've had a number of meetings with our Health Benefits Advisory Council, and some of the questions you're hearing today, labor's been a key part of this. They've asked some very good questions, and as we vet this with them, they will make a recommendation. Their recommendation isn't to the SJVIA, although they will come here and speak. It's actually to the County of Fresno Board ultimately. They still have to have that meeting. It has not occurred yet. But today's action is really go back, calculate the EPO rates. And I think we need clarification as to whether or not we want two models, one that has County of Tulare with an EPO and one that does not.
And I think you've seen the direction from several board members up here that Tulare County would like to see that calculation for our members as well. Any other questions or comments from directors? Okay, the chair will entertain a motion.
So moved.
Okay, we have a motion. And does that include
Yes.
Tulare County as well?
Yep.
Okay, thank you. From Director Magsig and a second by Director Mendez. All those in favor, please signify by saying aye. Aye. All opposed, the same. Motion passes unanimously. Worthley was trying to press his button and have it light up
Worked
there.
yesterday.
It didn't work. All right, next we're going to move on to item number 13, which is a request to receive and file the consultant's report on the Pharmacy Benefit Manager PBM marketing results. Gordon?
Right. Thank you. And this is an update on the process that we have gone through so far. We started the process back in March by having a list of vendors that we vetted through with SJVI staff to go out. And what we initially did was request an RFI for repricing. So there were about 136,000 claims that represent the 5 entities that are currently comprised of the SJVIA, to have them reprice, give us pricing values on it. And that was reported in the April meeting as well, too. We then had an RFP that also went out to be responded to. That's been responded to. We are now in the phase where tomorrow we have 2 finalist interviews, and we look forward to July 14th where we can bring back a recommendation at this point.
Okay. A question that I have is just based on that report, how did you select the PBMs that you were going to offer the opportunity to RFP to? We had an earlier public comment, and so that's the first question. Second question is it too late to add any others for consideration? And you can respond to both.
Sure. So the process was where Keenan, we developed an initial list. That list was then expanded upon by SJVIA staff and further expanded upon by receiving comments from, I believe, one of the Board of Supervisors from Fresno County relative to another vendor, which was Coast PBM. Coast. Yeah, Coast. Which ended up being a discount card arrangement, but they referred us to 2 other PBMs to have them provide proposals as well too. It's very unfortunate that we weren't able, that we weren't recommended, didn't have the knowledge of the PBM that made comment earlier today. Otherwise, they certainly would have been included in the process. My concern is with the information that's gone out on the April 28th meeting. There's financial disclosure there relative to the proposals and the repricing. And from a timing perspective, we need to move forward on this. We originally were looking at a 7/1 implementation date, and with that 7/1, the PBMs were saying, no, we need a lot more time to make sure we have a smooth implementation, to the tune of where even August 25th really doesn't give them adequate timing to do an appropriate implementation.
So maybe in the future, then that can be a part of it.
Correct.
And also, one thing I wanted to ask too is, just in the interest of transparency, when this new PBM is selected, is there any potential benefit to Keenan based on who is selected, or is that financial benefit, or is that something that is not a part of?
All of the PBM quotations include our pharmacy benefit services.
Okay.
That's valued at about $200,000.
Okay.
So there is an additional value to Keenan relative to that.
Okay. Thank you for the transparency.
Yeah, I would anticipate that we would, in our final report to you, give you documentation, and even I would anticipate that somebody from our PBM unit would be here on the 14th to explain the role and why we feel that's important, why there's a role there and why it's important.
Okay, great. Any questions or comments from board members or directors?
President Vanderpool, if I could just
sure.
add from a staff standpoint, I did have the opportunity to step out and talk to Mr. Dunn from IPM, and did confirm that they submitted a proposal in the past. It sounds like there was an attempt to contact staff through the consultant. They were unaware of the change in consultant, and so it's unfortunate that occurred, and we want to make sure everybody has the opportunity going forward. My question was the same one you asked. Borden is timing-wise, how would that work in the process? So, but I just want to know, I did have the chance to talk to them and appreciate them being here. Our interest is to have everybody involved in the process where we can.
Great. And this is an information item, and I normally don't take public comment regarding an information item, but I do have a request from Bobby Bloyd to speak to this item.
Bobby Bloyd, Fresno County Health Benefits Advisory Council Chair. We're asking for a request for consideration for some language to be added, and that is something that we brought up in the HBAC subcommittee meeting that we recently had, is to add language in the contract that allows us, when new prescriptions are released, to go back with the PBM and negotiate our best possible price for those new prescriptions. In the past, we've been just allocated whatever price the PBM deems is appropriate, not giving us the opportunity to negotiate our best possible price. So what we would like to do, and what we asked in the HBAC subcommittee, is for consideration to add that language in there so we have the ability to negotiate the best possible prices in the future for any new prescriptions that are released. Thank you.
Thank you. Any questions or comments from board members? All right. Thank you very much. This was just an information item. We look forward to the results coming at the 14th meeting that we have. Item number 14 on our agenda now is a request to receive the consultant's report on contracting directly with Chimenti and Associates Subcontractors, Hourglass Systems, Inc., and Administrative Solutions, Inc., and authorize staff to negotiate new agreements with these vendors to provide administrative services. Gordon.
Yes, thank you. As part of as when we were first hired, we met with all your vendors and tried to determine what their services that they were offering, the SJVIA were, as well as what the contract terms and so on and so forth were. We're coming back, and I think it goes to both the HMO EPO concept as well as the services that are rendered for your benefits administration system, as well as COBRA and retiree billing, where we looked at the contracts. We looked at currently the services are provided through Chimenti and Associates. Predominantly, the benefit administration services is provided through Hourglass, and the retiree and COBRA billing is provided through, oh gosh, sorry.
As you ring there.
Someone's calling. What we found was where Chimenti and Associates are very key to voluntary benefits for several of the SJVIA members. That fell really outside of the scope of the services that the SJVIA required. Those services were predominantly provided by the two subcontractors, Hourglass and ASI. So we did let Chimente know that we would be contacting the subcontractors directly, looking to contract with them. We take nothing away from their individual contracts with the individual entities to provide the benefits that they do to them directly. But we found that if we contracted directly with ASI and Hourglass, it would be about a $90,000 savings to the SJVIA. It's not in the millions, but it's $90,000 nevertheless. And so our recommendation is that we move forward with contracting with the subcontractors directly as opposed to Chimente and Associates.
Questions or comments regarding this?
A question I have.
Yep, sure, go ahead.
So how much additional work is this going to place upon you and maybe even our staff if we do direct contracting?
It really should be transparent that there's not even an implementation because they're in place already. It's really changing, it's the cost of contracting direct, reviewing the contracts, making sure all the terms and conditions are there. It's no additional, well, outside of that burden of signing the contracts, there really is no change in service, no additional transference of service to staff or anything like that.
And then looking at both Hourglass and ASI, are we planning on using both of those entities moving forward, or were we planning on looking at making any changes at some point in the near future? And would we need additional expertise if we did need to make changes?
You know, I would say this, that at this point in time, I've had no reason to believe that we need to make any changes. And as a matter of point, some of the entities that have withdrawn from the SJVIA, one of the pieces they've asked to take with them at their own cost were the services of Hourglass and ASI.
If I can add a couple comments to that. So what Hourglass does through their system is all of the eligibility feeds to all the providers, but in addition to that, there's a reconciliation to the premium to where down to the dollar, you know, as far as the actual enrollment of employees versus premium being paid. And that really makes, when that was first implemented, the SJVI, that in itself saved hundreds of thousands of dollars and hours of time. To your question, what I would recommend as staff is that we direct contract for the rest of the term of this arrangement, and at some point we would need to go back out again to bid for these services. I don't recommend doing that now for the sheer reason that we've got so many other changes happening at the same time. You know, this just proves that there is opportunity to look at these services again. I will tell you, it was when we implemented this several years ago, it was much more complicated than what we thought. And there's a cost to that as well. So my recommendation is maintain now, but we do need to go out to bid at the end of the contract.
Okay,
and I would just like to add for Tulare County, we contract separately with Chimente and Associates for our voluntary services. And so this will not have any impact on our contract directly with Chimente.
Okay, great. Any other questions or comments from board members? Members of the public, this is an action item. Okay, seeing none, I will bring it back to the board for action.
I'll move for staff's recommendation.
Okay, we have a motion by Director Magsig, a second by Senator Borges. All those in favor, please signify by saying aye.
Aye.
All those opposed, the same. Motion passes unanimously. We're now going to move on to item number 15, which is a request to receive the consultant's report on a 3-phase health management program model for wellness and authorize implementing the new model effective July 1st, 2017. Gordon.
Yes, I'd like to introduce Matt Zendersky from our Health and Wellness Division at Keenan. He works directly with the SJVI subcommittee on health and wellness, and he'll present. We have a 3-phase approach to implementing wellness, and he'll talk to that.
Great.
Good morning. My name is Matt Zendersky. I'm a health management specialist at Keenan. And my primary role at Keenan is that I work with our public agencies in their design, implementation, and oversight of their employee wellness program. Before I get started, I just want to say how excited I am to be here at the Board of Directors for SJVI and present this 3-phase health management program model that myself and my director, Dr. Robert Rager, designed for your group. I will share that we have used this model in the past with groups similar to SJVIA. It's been very impactful in moving the needle and encouraging employee populations in the right direction and ultimately help reducing costs. Before we do jump into the three-phase health management program model, I just want to share that we're going to talk a little bit about costs. We're going to talk a little bit about incentives. We're going to talk a little bit about a non-wellness medical premium and a tobacco surcharge. And I just want to reemphasize to the group that these are just recommendations. These are just best practice approaches that we have found to be impactful. It's ultimately going to be up to the SJVIA and the board of directors and the bargaining units how you want to move forward. So let's just keep that in mind as we go through this. But just starting in phase one in 2017, and this would be from approximately this time, and we've started with some challenges back in the spring, up until the end of 2017, some of the features that the program of the three-phase model will contain are a soft launch of limited scope wellness program. One of the first things that we encourage the SJVIA to do is a employee wellness program interest survey. Wellness is something that you always want to give the employees an opportunity to provide feedback and have the feeling that you're doing this in concert with them, not at them. Conduct a wellness program audit, and so that would be to look at your solutions and the things that you have available through your carriers and your different community-based resources and audit what wellness program resources that you have. Establish a wellness committee and wellness coordinator at each entity, which SJVIA, when I began working with your group back in March, you have a very involved group, especially at Tulare and Fresno and the city of Ceres. I've had an opportunity to work with Hollis at the county of Fresno, Lupe at the county of Tulare, and the group at Ceres. And so you have a lot of these elements built in. Determine wellness program provider, so that would be the identification of a third-party vendor, somebody that could really help come in and do a lot of the heavy lifting from your group. Program branding, so designing a wellness program logo, maybe an employee wellness program, a tagline, and then promoting participation in the initial program components. And what would those be? So we already had the Walking Works Wellness Challenge, which was implemented back in the spring, which you guys saw tremendous participation. You logged a lot of steps. Tulare Fresno one-day physical activity challenge, which we're going to go back and do like a tiebreaker here in the spring because the competition between the two counties is pretty heated. And so they want to do a follow-up challenge, which we're going to support. And then after that, what we're going to suggest that we do is start to use like an online platform that gives your members and the entire SJVI community an opportunity to participate in one challenge altogether, and it would be extended. So right now the challenges that you're doing are a day, a week. This would be like an 8-week challenge where there would be multiple different trackable activities involved. And then mammography screenings. I've had an opportunity to work with the SJVIA, our sub-wellness committee, and do an analysis of some of the providers for the mobile mammography, and we've identified a group here out of Fresno that we think is really best in class, not only in the services that they provide, the solutions, but also the cost as well. And then the incentive focused on participation is that individuals would receive a $25 gift card for completing the Health Trails Wellness Challenge. So if they do the 8-week challenge, they successfully log their miles, then they would get the $25 gift card. And then there's the estimated cost below. Okay? So pretty much just creating awareness. It's a soft launch. And then what we would do then is into phase 2, this is when your program would really start to ramp up. And it would have a lot more activities, solutions, things for people to get involved in. So you would have a full wellness program launch, collection of year one health risk data. I've heard a lot here today in discussions regarding how do we know where we're at? Do we know what our BMI is? Do we know people with blood pressure, not people, but the overall aggregate, blood pressure, cholesterol. So this would be the initial collection of that data. Focus on building awareness of the extensive program offerings. And what are those components? So we would on-site biometric screenings, wellness services, so you'd have an online wellness platform that would consist of a health assessment. And then with the biometrics and the health assessment, then we would suggest that there would be outreach to high-risk individuals based on those results. So if you had individuals that came through and they had some of risks that they would get outreach to, lifestyle management, coaching, and then 3 wellness challenges that individuals could participate online. That could be activity, stress, or nutrition. There's a myriad of different challenges that they could participate in. And then the incentives focused on participation and risk reduction. And again, this is just a suggestion. We are just throwing it out there. So the individuals who would successfully participate in the program and meet the requirements would receive a $100 gift card. And what those requirements would be completing an on-site biometric screening, completing an online health assessment, and then earning 100 wellness points. And they could earn 100 wellness points through the challenges, through the health coaching. There's preventative care trackers they can do. There's different online health education programs that they could do. And for participating and completing those activities, they would get allocated a certain amount of points. And so not only would you have, like they call your gateway activities, your health assessment, your biometric screening, but then the activities that really encourage people to drive healthy behavior change would be the ones that would be associated with the points. So you want to have sort of that two-pronged approach. Then there was the cost for the biometric screenings, and then the cost for the wellness services. Now moving into phase 3, and phase 3 is very similar to phase 2. And a lot of our best-in-class wellness programs, they keep the core components for a year-to-year basis, because what that does is that gets the employee population at the different entities used to knowing what they're going to be expected to do each year. So you don't want to make a lot of change because that can cause a lot of confusion. But you do want to add additional elements and new program resources. So one of the things that we would implement in year 3 would be condition management. And that would be the individuals after we've identified through the third-party vendor. And I do want to reemphasize to the board that nobody's personal health information gets shared with their employer or their insurance company. So this would be done through the third-party vendor. Once those individuals, through the claims analytics, the health assessment, the biometric screenings are identified, then they would get outreach by like a registered nurse, a registered dietitian, somebody that can really help them in the areas where they might need additional assistance, collection of year 2 health risk data, intensive communication campaign to highlight the premium-based incentive design. And I also want to share, too, in phase 2, one of the reasons why we just have a gift card is because, like I've mentioned, we understand that there's going to have to be negotiations with the bargaining units to then, in this phase 3, move to the premium-based incentive design. Also, participation in 2019 would result in a lower premium reduction if you chose to go in that direction in 2020 for the people that successfully met the requirements. And then the tobacco use surcharge. And I do want to share something about the tobacco use surcharge because we had a public comment made earlier, is that an individual has 2 options with the tobacco use surcharge to make sure that they don't have to pay the surcharge. Number 1 is be a non-smoker, and then number 2 would be to complete a tobacco cessation program. And that individual could technically, if they wanted to, smoke right through that, but they would still have to sit through that and get the education. So they're not forced to. You know, you'll see that people are going to get the stick. We're going to come out here and penalize all the non-smokers. Well, you can conform and not smoke, or you can go to some health education classes and take the knowledge, and that also qualifies. You have to provide a reasonable alternative standard. And so there's a lot of that built into this program.
Good thing Alan Ashita's not on the SJVIA anymore, because I tell you what, he smoked like, 8 packs a day or something? Hey, go ahead.
No,
sorry about that.
So we'd have the biometric screening, we'd have the
Only
wellness
for
services,
tobacco, right?
and I'm not going to go through these verbatim because we've already discussed these earlier. And then the incentives focused on participation, risk reduction, tobacco cessation. So individuals who successfully completed the program, who are participating in the activities, they would receive a $50 a month lower wellness medical premium rate for 2020 for meeting the requirements. But it would be the same requirements that they were asked to do in 2018. So it would be the health assessment, it'd be the biometric screening, it'd be the earning the 100 wellness points. There's the cost that you have there in phase 3, but then also what you would start to do at that time is that you would start to generate funds for your program to be self-sustaining. So the individuals who wouldn't meet those requirements, that money would just be redirected back into the program to help fund future years. And that's what a lot of our best-in-class programs are doing, is that they use this risk stratification and they use this medical premium to sustain their program so it's cost neutral. And so it's beneficial. It's a win-win, not only for SJVIA, it's a win-win for the employees. So any questions? And I tried to get through that as quickly as possible.
You did a great job. All right, question? Go ahead.
So looking at some of the phase 2 and phase 3, some of the larger implementation here, so are you planning on bringing in outside entities to work with the cities and the counties to create programs that are specific for individuals within the pool? Is that correct?
Yeah, and it would be a little bit of both. And what I mean by that is that we would want to have the core components, the health assessment, the biometric screenings, the different online challenges. But I know that you know Fresno and Tulare are already doing activities, and so we could still do those customized programs and build them into the point system.
Well, would you do the biometrics, or would you bring a consulting group in that would do both implementation, but they could also do the collection of data points?
Sorry, so we would continue to be the consultant. But we would bring in best-in-class third-party vendors, and we already have one identified in the market, but I understand that you're a public agency, so we may have to do through the official RFP. But we could bring you, 5 or 10 that you could review, but we would bring in a total comprehensive third-party.
One that I'd like to see to be included in that competitive process is Pinnacle Training Systems.
Okay.
And the reason I bring them up is in Clovis.
Campaign contributions to your campaign. No. Come on, Maxie.
In Clovis, Pinnacle Training Systems worked with our police and fire department and had some great results working with them.
Sure.
So I would just like them included in the
Absolutely.
competitive process. If they work out, great. If not, that's fine too.
Absolutely.
Good idea. No, hey, come on. I'm just keeping it light. Any other questions or comments about this? I think this is great. One question that I would have is, I know that we tried doing this, or not this exact thing, but a few years ago, we did the biometric screening. Well, then we changed vendors. I don't know why, but we changed vendors, and I'll just talk about my own personal case. I lost my screening from the year before, so I couldn't see if I improved from the next year because they didn't have access to the previous year. So I didn't qualify, but I just think that element of consistency, and you hinted at it with just building up year in, year out, keeping the same structure. I hope that we're going to be able to keep the same vendors too, because I'm sure that I wasn't the only one that couldn't actually see if I had improved or not.
Yeah, and that's unfortunate, but vendors a lot of times won't share data for privacy and HIPAA regulations. So, but yeah, we would fully intend to continue to have the same vendor throughout the program.
Okay, great. I do have a request from Bobby Bloyd to speak to this item before we take action.
Bobby Bloyd, Health Benefits Advisory Council Chair. The Health Benefits Advisory Council is very much interested in health and wellness of the employees. In fact, we've actually started a wellness subcommittee at the County of Fresno. So we're willing to try to do as much as we can to improve the health of our members, because ultimately that will help us save money. That being said, there's two questions. One that's going to have to be addressed with management is earning these points and participating in these programs. Is that going to be something that's going to happen during working hours and on site? Two, and don't shoot the messenger here, the original draft which proposed implementing the surcharges next year, which this is the second draft we've seen, was sent out by many organizations to labor. The emails that I got back and was requested to relay today is implementing these surcharges may potentially lead to litigation. So please keep that in mind as you look forward at these surcharges going forward. We've already got enough legal problems as it is. I don't think we need a bunch more, but thank you.
Okay. Any additional questions or comments? I do have one more. Please come forward.
Hi, Sandra Brock. I'm sorry, I didn't know I needed to fill out a separate sheet each time.
Oh, you're fine.
I don't see that the retirees get included in many of these, and yet, although the sins of our earlier lives may catch up with us, we get to commit new sins because we're not working and we're literally not moving around as much. So I'd like to see some outreach, and that your retired employees get a chance to participate. If you want to make a namby-pamby one for them, fine, but it would be nice to have something. I mean, our annual benefits fair where we decided to sign up or not, the woman sitting at the anthem table couldn't even answer a single question about the plan. So clearly, we don't get the full benefit fair like you do at the basement of the county plaza with the screening and the tests and the giveaways and stuff. We could use a little more help there. Secondly, I was hope that you'd integrate this with your personnel rules. I worked at the library, and it's very difficult to get your walking in the library. You disturb people. You're supposed to be quiet, and people are supposed to be able to concentrate. And yet we had employees get written up for so much as walking out to the parking meter on the sidewalk outside of the main library for, quote, leaving the workplace during break time. So hopefully you'll get with your personnel departments or your respective agencies and let people use their break time for their wellness. It's supposed to be a break. It's supposed to be something that helps, stretch different muscles. Thirdly, maybe it's the HD PPO plan, but Anthem does not seem to have very good pharmacy benefits. I'm really glad you're looking for a new PBM. But if a person's got blood sugar that's borderline, it's really hard to check it as often as you want to when it's $1.50 a test strip. So perhaps you would integrate your wellness plan with your PBM plan and make it more affordable for employees to monitor their blood sugar. I know the test strips are little computer chips in and of themselves, but my previous insurance plan, my copay was $25, and this time it's $150, which is a little hard to stomach. Thank you.
Any additional public comments?
Good morning again, Laura Hernandez. In listening to the gentleman who spoke about the three-phase program, it dawned on me that in implementing this whole process, you have to have a buy-in also of all the employees. So I totally understand the goal. But I just wanted to encourage or recommend that they do include employees as part of those committees. I think it's really important that everybody is as engaged and empowered to do so, but going through the process, you also need to include employees in the process so that, again, there's that empowerment that, hey, I'm part of something greater, and I think that might encourage more people to participate in the process. That was my recommendation. Thank you.
Thank you. Any additional public comments? Okay, seeing none, I will bring it back to the board for further discussion and or direction. Or you can just look at me, Borges, whatever you want to do.
Senator Borges.
Oh, sorry,
Senator.
Go ahead, Dave. Do you have any additional
I did want to
comments?
share one thing relative to the wellness. As Matt mentioned, we are going to be looking to our vendor partners to reach out to them, see how they can support our wellness program and so forth. And in an effort by Kaiser to really share goodwill and their intent on moving forward in a true partnership with the SJVIA, they've dedicated $25,000 to the wellness program for usage in 2017, as well as they'll be making a commitment to that. And that's for the wellness program basically to use as deems fit, whether it's $25 gift cards or whatever it might be. But there'll be further not concessions, but there'll be further information I'll be providing relative to the relationship with Kaiser. But I did want to put that out there because it's related to wellness. Thank you.
Great. I thought that was a great presentation. Thank you, Matt. That was very well done. I think there's a lot of very beneficial items that are included in there, and we've talked about this for years, getting to a point where we incentivize better health and well-being with reductions in premiums, and unfortunately a surcharge, if you want to call it that, for negative health behaviors. I know that all has to be negotiated, and our employees will be included in the process, but I think that you can lead people with carrots, or you can get them with sticks when they do not do the things that are positive for their health. And I think that that's really what this is going to do. And I see this is really the only way that we can contain our costs on a go-forward basis. So I'm very supportive of this wellness effort. Even though it is a 3-year plan, I think that we got to start somewhere. I do think we will be very inclusive of our employees, and I know this will be very effective and positive for us. Any additional questions or comments?
I'm not speaking anymore.
Okay, Senator Borges, we're looking at you. You have any more comments? Oh, Supervisor Crocker.
Unrelated to this item.
Okay.
Can we get an update at the next meeting on past closed session? Thank you.
Motion to approve.
Okay, we have a motion from Director Worthley.
I'll second it.
We have a second from Director Mendez. All those in favor, please signify by saying aye.
Aye.
All opposed, the same. Motion passes unanimously. I know there was a clarifying question that Supervisor Pacheco had regarding our next meeting.
Yeah, according to the schedule, it's July 14th here in Visalia. I know that day typically is the water day, buddy. There's a conflict. Both are on the schedule. You and Supervisor Worley are on there. Are we going to keep the 14th? Are we going to move it? Is it going to be here in Visalia? Is it going to be in Fresno? Or what is with all of us here, what is the plan at this point?
Paul?
Since it is only 2 weeks
believe
away.
The July 14th meeting originally was going to be in Visalia, but we had moved it to Fresno because we had put this meeting in place. I think was what we had last determined.
So-
And this is the first I'm aware that there.
Yeah, the second Friday of every month is the JPA water.
Conflict.
Every time, we've gone over this before,
Now we're
but the
thinking
second
Valley
Friday
Water.
every month is the
but it's not
JPA
on
water.
my schedule. I wonder if
It is. No, it's
It's on our
there.
schedule.
Yeah.
I'm actually going to be on vacation, but
okay, that's
for
the
both
alt-
meetings.
That's why Steve's going to be going.
Is it a GS?
No,
It's
the San
authority.
Joaquin Valley
It's
Water.
the authority
Oh,
meeting.
oh,
Temperance.
oh,
Monthly
oh,
authority
oh,
meeting. For some reason, I thought they were
yeah,
different
okay.
times. I thought they were
Yeah,
scheduled
it is
different
the same
times.
time. It is.
No, it's both at 9.
If they're both
Is
at
it
9,
necessary?
can we look at making the meeting, say, at 1? The SJVIA meeting can be at 1
And
that
if you
day,
had it
maybe?
in Fresno, then the people would have.
Yeah,
Yeah, that would
be
work.
good.
How about 1:30?
Ooh, where are we going to lunch?
Now, come on, that's just like you're
Richards?
grasping for straws there.
Yes, I
That's being
am.
very nitpicky there.
One thing
1:30?
after me. Yeah.
1:30 possible? That half
Yes.
an hour going to throw you off, Paul?
I'll just say, subject to we've been using the SJVIA Board chamber, so we'll confirm that it's available.
Okay.
I assume it is, but we'll confirm that and can then notify everyone and publicly post it.
Okay,
1:30
perfect.
So 1:30 on July 14th.
1:30 on July
Do
14th.
we have a
Any
quorum? Are you going to be there?
any additional questions or comments?
Are we going to have a quorum? I'm not going to be there.
I'm going to be there, and Crocker.
I'll be
we've
there
got
if we
audit
move
committee at
if we
10.
move the. Well, I'm gonna be. I won't be at audit committee. I'll be
Okay.
at the
at the
temperance.
JPA.
Yeah.
So we will have quorum.
Can we also ask to look
Sure.
at August 25th? And is that a conflict with any of the other committees? That is Friday.
No,
Looks good.
Right now, it's good.
25th is good.
Looking
Thank
forward
you.
to that.
Possibility.
That one will be here in Visalia on the 25th.
That's going to be. Okay, all right. So let's see on the 25th. I think I put that in there already. But yep. Oh, we're good, and that's here in Visalia.
So the 14th will be at 1 or 1:30?
1:30.
1:30.
I guess Mendez needs a little bit of extra time to eat his lunch. I guess that's what happens when you're old,
Richards.
right? Okay. Any further questions or comments? If not, we will move on to Director Crocker's favorite item on the agenda, and that's adjournment. Thank you for attending today's board meeting. Everybody have a great 4th of July.
You know, Supervisor Vanderpool